Hi, my name is Elizabeth. Today we'll be doing sinus x-ray. So before we get started, I need to go get my patient from the waiting room. I need to ask the patient to tell me their full name and their date of birth. Once I verify that, I will take the patient to the room and then I will just ask my patient some history. If they are female, I will ask for their LMP, the last menstrual cycle. And then from there, I will ask them any previous surgery or injury to your neck, your sinus, your ears, your skull, anything like that. And then I'll just ask them what is the reason for the X-ray today, and then if they said they had any injuries, ask them if they any bruising or swelling that they notice, how long has it been going on. And then I will inform my patient before we get started if they have any necklace or earrings or any glasses, they need to remove that. Anything, a metal piece in their hair, anything like that. For in their mouths, just make sure they remove their dentures or anything metal in their mouths. Also remove hearing aids as well. So once I instruct my patient to remove that, I will take them to do their x-ray. So the first thing we're going to do for sinus, we're going to do a PA. For this one, they're just going to put their chest against the wall. Well, I'm sorry, their head against the wall for me. So they're just going to have their forehead resting against the wall, and I'm just going to make sure that I have my SID at a 40, and then I'm just going to make sure I do I angle the tube at 23 caudal, and I make sure that I'm aligned to my bucky, and I collimate to a 5x5, and I just go to the patient and I touch their head and I make sure that they're not tilted or rotated or anything like that. Their body is straight and they are centered to the 5x5. And I'm going to put my centering point at the exit at the nasion. And then the next thing I'm going to do is I'm going to make sure that I have my OML and my MSAP perpendicular to the IR. I'm going to put a shield to the patient, and once again, I'm just going to make sure that they're not tilted or rotated, anything like that. So once I check my positioning and if I like it, I'm going to inform the patient, don't move and don't breathe, and then click. I'm going to tell the patient to relax. So the next one we're going to do a Waters open mouth. For this one, same positioning. They're going to be standing up. They're going to be facing the wall buggy. But for this one, I'm just going to tell my patient to put the chin against the wall buggy. So then once again, I'm going to take off the angle on the tube, and it's going to be SID 40 at no angle, collimate to a 5x5. Also, I forgot to mention in the other one, you have to put your marker. So I'm going to put my right marker on the where I have it collimated on the open light field, and I'm gonna make sure that my patient's head is not rotated or tilted, and I'm gonna make sure for this one that I center at the exit of the cantillon, and I make sure that my MML and my MSAP is perpendicular to the IR. Once I position the patient and make sure they're not tilted or rotated, I'm going to put a shield on the patient, and I'm going to inform my patient, for this one we're going to have you open your mouth, but we're going to make sure that you just open the lower part of your mouth, not your whole face. So this can be very uncomfortable, so I have to do this like as fast as I can. So once I see my patient is positioned, I'm going to tell my patient, open the lower part of your mouth, and then don't move and don't breathe, and click, and tell the patient they can relax it now. So for the next one, we're going to do a lateral. So same position, they are erect, but this time we're going to put them in an LAO, an oblique. So I'm going to inform my patient, I'm going to move my patient to an LAO position. Everything is still the same. SID is 40, collimate 5x5, but then I'm going to put my left marker in the open light field. I'm going to position my patient, make sure they're not tilted or rotated. I'm going to center at the I'm going to center at on the outer, midway between the outer and canthus, and then also at the EMA. And I'm going to make sure that my MSAP is parallel, my IPL is perpendicular. And then from there, I'm just going to make sure that they're not, once again, I'm going to make sure they're not rotated or tilted or anything like that. Make sure they have the shield on, and tell my patient don't move and don't breathe, and then click. I can tell my patient to relax. For this next one, I'm going to do the SMV. For this one, I'm going to make sure that my patient has their back against the wall bucky. I'm going to tell my patient for this one, I'm going to need you to lean your head backward. So they're just going to go like this. And same thing, I'm going to do SID 40, column 8 by 5 by 5. I'm also going to put my left marker. And then I'm going to center at the Canthion. I'm sorry, the Ganion. I'm going to center at the Ganion. And I'm going to make sure that my MSAP is perpendicular and my IOML is parallel. Just once again, I'm going to make sure that there's no rotation and the patient is very straight. And I'm going to put shield on as well. And I'm going to tell my patient to don't move and don't breathe, and then click. And then we're all done. Thank you so much, and I do apologize for stuttering. I was very nervous, so thank you.